Hello, my name is Reese Zulke. I'm a student at Lake Superior State University, and I'm doing this presentation for my medical terminology class for the spring semester 2020. So this presentation focuses on the body system of the endocrine system, and so that relies on the hormones in the body. And I've chosen 3 articles in that subject, and the first one is on overtraining. So basically, overtraining, it occurs when the body experiences an overstimulation of exercise or strenuous activity. So it often occurs during sports or usually mid-season for most athletes, and their body just can't quite recover. So this results in a decreased performance, loss of sleep, irritability, stress, possible injury, and metabolic imbalances, and many more things. So the article I found, in efforts to diagnose overtraining in athletes, sports medicine doctors performed a 2-bout exercise protocol on 10 willing participants. They were diagnosed with overtraining, and the experiments were conducted on a cycloergometer, so a bike, and a treadmill. These results concluded that with those with overtraining syndrome reported no significant increase in the prolactin hormone concentrations found during the second exercise bout, whereas non-functional overreaching patients showed that quite the opposite. These findings show that on the non-functional overtraining continuum, a hypersensitivity of the pituitary gland is followed by an insensitivity or exhaustion afterwards. So these results indicate that there may be a correlation between overstimulation in the pituitary gland and the release of hormones, along with overtraining in athletes. So something I learned from this study is that a difference between day-to-day and a clinical term of overtraining to define why some may experience injuries or disinterest in activities. And this follows repetitive or monotonous training. So if you're doing the same thing in practice every day, the athletes likely get bored, or they just don't feel as involved, or if they're not receiving proper guidance or giving credit for what they're doing, positive reinforcement. So my interest stems from my background of sports and living through periods of disinterest or general unhappiness with activity within a sport. I used to always go through the practices and not understand why I might be feeling disinterest or withdrawal from wanting to do the activity when I knew that I really did love it. I would just go into practice and not really understand why I'm kind of off that day. I always thought you just go through moods and injuries, and I thought nothing beyond daily responses to stressors. An interesting point that I found in this study is that overtraining can originate from the lack of stimulation from the pituitary gland, or a hyperstimulation, which can also exhaust it. The next study I did that I looked up was a meta-analysis on Parkinson's disease. So this included 14 studies, and there's a total of 495 participants. 67 were male. So Parkinson's disease is a neurodegenerative disorder affecting the physical, psychological, social, and functional status of individuals. The behavior of neurons in the basal ganglia is severely disrupted, so just a decrease in brain activity and cognitive awareness, really. The dopamine content of the hypothalamus is considerably reduced in patients with PD, and the effects of prolactin release from the anterior pituitary gland, or it affects the prolactin release. So the aim of this review was to evaluate the effectiveness of exercise interventions in randomized controls trials to undertaken with people with PD. So they tried different exercise bouts, different approaches to try and stimulate those with PD and try and come up with a solution to help not resolve but reduce the onset. So after these trials, there was a report of increased muscle strength and an significant improvement in leg muscle strength by 3 studies. 5 studies reported balance improvements, 4 studies showed improved gait, and 2 studies reported reduced falls from exercise intervention, because sometimes you start to notice a lack of movement in their legs or their arms or just body movement in general. They move pretty quietly, and so they may begin to trip, lose their gait, drag their feet, trip and fall, and not really know what's going on with their bodies. So the study identified that exercise is a benefit to people with PD in respect of creating a higher quality of life and physical functioning. So I learned that individuals with Parkinson's disease often develop depression, but being that exercise is seen as a task for improving cognitive awareness, it doesn't directly seem to stimulate the common theme of partially alleviated depressive feelings following exercise. So even though during overtraining, exercise causes the disinterest in the sport, or usually during other symptoms of diseases such as depression, exercise can help alleviate those symptoms, but as with Parkinson's disease, it's more of seen as a chore just to help them cognitively feel a lack of those symptoms, so depression doesn't really come into play right there. So my interest stemmed from my internship that I had last year. We had a patient that we seen. He had an early onset of Parkinson's disease, and he didn't understand what he was going through and why he wasn't quite operating how he used to. His body wasn't moving the same way it used to, and people around him were noticing, but he really wasn't. So we incorporated the LSVT BIG program, which basically it just helps the patient move bigger, so louder. So like instead of they'll notice that they'll clap like this, you want them to clap loud. You think that they're quietly walking or making very small strides, and you want them to elaborate on those strides and take bigger steps, such as Frankenstein walks, or when they're just small movements, almost as whispers, we want them to yell. So the next study that I found was on Addison's disease. So Addison's disease is a adrenal insufficiency, and it's an uncommon disorder that occurs when your body doesn't produce enough of certain adrenocortical hormones. So in Addison's disease, your adrenal glands they're just above your kidneys, they produce too little cortisol and often too little aldosterone. So these hormones regulate carbohydrates and electrolytes, and when they're at a deficiency, they can be life-threatening. So the article I found was conducted on a postal survey of Addison's patients in 4 countries, which are the UK, Canada, Australia, and New Zealand. So the respondents were asked to identify all factors that led to adrenal crisis needing an emergency response. So they often reported vomiting or diarrhea that triggered more adrenal crisis than more other than factors, and were responsible for more than half of all the crises reported. Next was flu-like illnesses and associated major infections. And then following that was surgical procedures carried out with insufficient steroid cover. So the emergencies for Addison's disease can stem from something that may appear to be simple to the non-dependent population, such as a simple infection or injury. And around 8% of diagnosed cases can be expected to need hospital treatment for adrenal crisis annually. So things such as exposure to gastric infection, that's the single most important factor predicting the likelihood of adrenal crisis. So associated diabetes and or asthma increase the frequency of adrenal crisis reported by patients. So something that I found interesting is that Addison's disease can't be prevented, but there are steps you can take to avoid the crisis. And it was found that almost 1/3 of incidents occurred away from home, and 20% of victims injected themselves when needed, and a lot of them didn't even have a hydrocortisone shot ready. So they often required their significant other to do the injection or go to the hospital, or they just wouldn't do it themselves. I learned that patient education is vital because it is a condition that requires a self-monitoring of symptoms and to take the necessary steps for personal safety and regulation for the disease. So personal responsibility, stepping up and understanding warning signs and when to report yourself when needed. That's pretty much all I have on this assignment, and thank you for your time.